Hello, everybody.
Hi everyone, thank you for tuning in to another episode of Wellbeing Makes Sense.
So today we're going to be talking about arteriosclerosis, which is a very common medical problem. A lot of people are suffering from it, and you are probably suffering from it too. So stay tuned and learn about the remedies that can help you lower your risk of developing it. So, as we are talking about arteriosclerosis, let's start by defining it. So, what is arteriosclerosis?
Arteriosclerosis, how to best describe it? It's, layman's term is the disease of the blood vessels, right? And it leads to multiple complications throughout the body and major organs. And the major issue about arteriosclerosis is inflammation. That's what, if people have heard plaque formation, it's a buildup. You know, everybody is born with nice, open, patent blood vessels. And throughout the years, as we grow, you know, there's damages done to our blood vessels also grow and age. And when we have a risk of increased inflammation, damages to our blood vessels, then we develop the disease of arteriosclerosis that leads to many complications, which we're going to discuss. So we never hear about arteriosclerosis per se, but we do hear about heart attacks. We hear about strokes. We hear about kidney failure. And guess what? How does it start? Is through the process of arteriosclerosis. So as you age and you get older and you had poor lifestyle, we had poor lifestyle choices, we cause damage to our blood vessels. And our body, the way God created us, that it repairs the damages. So as the blood vessels gets damaged and repairs and damaged and repairs, and so it starts stiffening up, you know, and it starts the scarring, we call it the plaque, starts forming and to heal itself. But guess what? The more the damage and the healing process goes, the smaller and the thicker and less flexible the blood vessel becomes. And sometimes the plaque, the buildup in the vessels, dislodges, and it goes to smaller vessels in our heart, smaller vessels in our brain, causes stroke. The other factor is the blood clots, right? So imagine a nice open passage, blood flows nicely without any restrictions. But as an artery stiffens up, the flow of the blood slows down. And if you imagine, when you bleed in a few minutes, what happens? Your blood thickens and coagulates. And that's what the blood clot is blood that coagulates. And when it finally pushes through, it gets stuck into smaller vessels of our heart, of our brain, and other organs, and causes the strokes and the heart attacks.
So another one of the complication is angina. Angina is basically chest pain. When you start feeling pain in your chest, so that's what we call angina. And that usually leads to a heart attack. It's one of the signs of a heart attack. So what happens is that the blood clot travel to the coronary arteries. Coronary arteries are the arteries that basically supply the heart, supply blood to the heart itself, right? So the heart need blood itself so that it can continue to function. So when the clot go enlarge in one of these arteries, then so that part of the heart cannot receive blood flow. They cannot receive blood, and basically this part of the heart is affected. They cannot function properly. So that's why you feel chest pain. So this is a sign. So this is basically a complication, and one that you need to take very seriously. And in addition to that, they found that the increase arteriosclerosis, another complication, is basically erectile dysfunction. So you become, so blood flow is not, the blood is not flowing properly, and preventing you from having, preventing male from having a good erection. So we touch on all the complications, on the most important complications. So there are tons of other complications that can happen from this, because once a disease affects the circulation of the blood, then you can end up with a lot of complications. So so how do we look at arteriosclerosis on a clinical standpoint in the medical field? What do we do to address this issue?
Well, basically, your primary care doc, your family doctor will, with your yearly checkup, do a yearly blood work, and they'll look for the cholesterol levels. Your triglycerides, your LDL levels, your HDL levels, and figure out, your risk factor for high cholesterol.
So basically, the numbers that you need, total, your basically look at four elements in when considering cholesterol. You have your total cholesterol, that when they measure it, it needs to be less than 200 milligram per deciliter. If it's over that, over 200, especially when it's a factor, and if it's over 240, 250, then it's definitely an issue. That's what we call high cholesterol, so you need to address that. When considering, so total cholesterol, even if it's, so we want it to be less than 200. Also, we will look at your HDL, what we call the good cholesterol, and these need to be above 60, while your LDL, the one that we call the bad cholesterol, need to be less than 140, and your triglyceride level need to be less than 150. So these are the numbers that your doctor is going to look at, and eventually start giving you medications if your numbers are too high. And what are the drugs of choice?
So if you have a great doctor, they're more likely to talk to you about lifestyle changes. Then they'll go into medications. There's out there, they're called statins, that will help lower cholesterol levels in your system. And statins, they have their own side effects that we can discuss in another video. So statin is like the drug of choice when you're suffering from high cholesterol.
So, and we don't need to talk too much about them, because what we want to focus on are the natural remedies, what you can start doing to help lower your cholesterol level, and especially lower the bad one while increasing the good one. So let's go. Where do we start?
So keep in mind, arteriosclerosis, the underlying issue is inflammation. So we're gonna help you to see how to reduce reduce inflammation. Let's start to talk about what we eat. So let's fats. There's good fats and bad fats. We have the mono unsaturated fats and the poly unsaturated fats, and those can be found in avocados, coconut oil, extra virgin olive oils, nuts and seeds.
So you need some fat, because a lot of people, I know that there are a lot of diets out there saying that you don't need fat. Well, you need some, because your body needs it. Your brain is basically made of fat. So you need, but you need to pick carefully what type of fat you are getting, which means be careful where you are getting your fat from. So fat that you need to avoid are the saturated fat and the trans fat, and also hydrogenated fats. Hydrogenated fats, when you are reading labels, you will see them, and most of them, they are basically manufactured in the place where they are doing them. So these fats you need to avoid.
Like canola oil, vegetable oil, these are no. Butter spreads, stay away from those things. Cream cheese, I can go on.
Yeah. And also you need to avoid refined carbs. When you take refined carbs, one of the things that you need to understand is what happens in your body when you are eating carbs. When you take a lot of refined carbs, it goes through your blood, and carbs are basically used, sugar are basically used for energy. But you're not moving around that much, so a lot of the sugar stays and is not used. So, and when this sugar is not used, the body will try to save it. And the way that it saves it is by transforming that sugar into fats, right? So the sugar becomes fat, and that's where the problem is. So when you eat a lot of refined sugar, the body can't use all this sugar at once. So a lot of it becomes fat. So this is why we said avoid refined carbs. Avoid the white bread, white rice,
sugar.
Yeah. So instead, use the whole grain stuff, because the whole grains, they have fiber in them that allow the sugar to move slowly, so that your body don't have to transform anything into fat. So use the whole grain stuff, and that will be better for you. One that we talk very often about is regular exercise, that always come through in almost all our videos, really. 30 minutes a day, 4 or 5 times a week, do a little walk, do a little jog, because your blood vessel will benefit from it. Your heart benefit from it, make your heart stronger. Your blood vessel will become stronger, and basically, it's a whole package, really.
Yeah. Another thing, bullet point that we want to hit is reducing stress. We can't, you can't spend 24 hours in a stressful state. You can't be flight or fight situation, because that damages your the blood vessels. There's the hormones, adrenaline, that we should not be continually exposed to, because that damages, it stiffens the blood vessels and limits circulation. So ways to reduce stress is, again, sleeping well, eating well, exercise, knowing personally, when you had enough, allowing yourself to say no, and allowing yourself to get away from the stressor.
Yeah, so, and this is a very important point, and we made a whole video about stress, so please watch it, because stress it's not just what you see on the outside. There's more going on in the inside. So please watch our video if you haven't done so yet. Quit smoking. I know it's a big issue, and a lot of people are dealing with smoking, and it's very tough to quit. But this is a very important thing to do. Smoking doesn't just affect your lungs. You know, every time I talk about somebody about quitting smoking, the first thing that they tell me is that, you know, I know somebody who smoked for 40 years will never have lung cancer. You know, well, smoking is not just about lung cancer. Lung cancer is just one of the complications. There's so many more complications, and this is one of them. Can lead to a heart attack, can lead to a stroke. So please, find a way, find a method, do some research, and quit.
Along with the same line of smoking and drug use, definitely harms your circulation. Alcohol also harms circulation because its dehydration just damages your blood vessels. One of my favorites I discovered recently is essential oils. There's a ton of them. Researchers have done that, you know, this little oil that you're diffusing throughout your house, that you're using in your daily care, laundry, house cleaning products, definitely helps with that disease. You know, there's lavender, ginger, what else? Name a few. Lemongrass,
Yeah.
clove, thyme.
And we also have a video about essential oil, so please check it out. You'll learn a lot from it. Another thing that we want to suggest to you is use omega-3. You know, omega-3 it's widely used as a dietary supplement. Also, you can find it in from many other sources. The most popular one is from the fish oil, but there's also the vegan one coming from the seeds, from flaxseed. These also are pretty good. So omega-3, it's a good fat, the one of those that you need.
Yeah. So again, mentions of potassium, magnesiums. You know, we don't need to go into the drugstore and look at the vitamins and say, okay, this is a potassium, calcium, magnesium. All these things help. So if you're eating healthy, you're exercising, you're eating, your greater meal is green and colorful, we won't need to supplement with the vitamins because we're getting it straight from the earth, organic. So how do these things work? Potassium, calcium, magnesium, all these things, they definitely promote some blood vessel health, and therefore decreases the risk of the plaques that we spoke about that causes arteriosclerosis.
All right. So this is our advice for you. So please take this topic very seriously. You can save a lot of lives. You can save your life and the life of so many. So please like it and share it with all your friends, your family members, especially those you know who are prone to these conditions. So please share this video with them. And we'll see you next week.
All right, check out other videos that we spoke about: stress, essential oils, what else? All of them.
Yeah.
Just check all of them. They are all related, and we want you to be prosperous in health, and God bless you.
All right. Bye.